Limberakis. I want to start off my very first of hopefully a series of interviews with specialists and doctors around the country related to dentistry and some not, and I'm calling it Doctor to Doctor. Inspired by, of course, Dr. Steve Brule and Brule's Rules. It's hilarious with John C. Riley. Hopefully this series will be a little bit more informative and less hilarious, but we're going to start off the series with a good friend of mine, Dr. Rami Elsabee. And you know what? Why don't we just have you introduce yourself to the audience?
Hi, everyone. I'm Dr. Elsabee. I'm a practicing endodontist in Stratford, New Jersey. That's how I got to meet Dr. Limberakis, and we practice very closely, see different patients together, provide a good dental team to our patients. And a little bit about myself. I am Egyptian. I grew up in Egypt, and I practiced dentistry in Egypt before I moved to the States, specifically Minnesota, where I lived.
Dentist first, and then you came to the States, and then did you do your training there as well?
Yeah. I went to dental school in Egypt, and I practiced as a general dentist there before I moved to the States. Here, my family is in Minnesota. And I was in Minnesota till I got accepted into Penn Dental here in Philadelphia for the dental program. So I had to do dental school again here in the States.
Fun.
And yeah. I liked it so much. I stayed at Penn for my endodontic training, doing my endodontic residency there for another 2 years. And here I am still in the area. I live in Philadelphia, and I practice in Stratford, New Jersey, and part-time in Exton, PA.
Oh, no kidding. Okay, I didn't even realize you're out in Exton. That's fantastic.
Yeah.
Great. So tell me a little bit about your training history. I know that you said you started as a general dentist and you went to school for endodontics. How does that process work after dental school, and what is endodontics?
Well, an endodontist is a dentist who specializes in a specific part of dentistry, which is root canal treatment. And to get to do that, you have to go through a special training, which we call endodontic residency, usually 2 to 3 years of dental training in one specific part of dentistry. And we do treat mainly teeth that require root canals. And for that, we have to get trained on special equipment, such as the dental microscope, which allows us to magnify the inside of the tooth to a very high degree, sometimes to 25 times the naked eye. Also, CBCT, which is a 3D X-ray that allows us to identify and diagnose different dental infections, dental anatomy of teeth, allows us to better treat our patients. But for the most part, what we deal with is root canal treatment, some surgeries, some trauma, but mostly people in pain or with infections. You can pretty much think of endodontist as more like the ER room of dentistry, where we deal with a lot of people in pain, a lot of people with infections, and we're usually the last stop before we condemn a tooth to be extracted. So if a patient wants to save their tooth, usually they make a stop in our office and we give a recommendation whether we can save the tooth or not.
That's a very comprehensive explanation. You hit on a hot topic term for a lot of people, root canal. Can you explain what a root canal is?
Well, root canal treatment is a dental procedure, not very different from a dental filling. It's more in-depth dealing with the roots of the tooth, where the nerve of the tooth lives. Basically, if your dentist tells you need a root canal treatment, it's for one of two reasons. It's either inflammation, which is usually associated with a lot of pain, or a dental infection that could be painful or not even painful sometimes. And what we do basically for our patients is to clear the source of the problem, which usually in the nerve of the tooth. And if you think of the nerve of the tooth, it's the inside of the root. There's a canal, what we call pretty much the nerve of the tooth. And the best way to describe it is almost like the lead that runs inside a pencil, for example.
That's a good analogy.
Yes, it runs all the way down, and at the end of the root, there is a small channel, and that's how your body talks to the tooth through nerves and blood supply. Sometimes that could get inflamed or infected with microbes, and my job is to pretty much just clean that up and give your body a chance to heal. Yeah.
Interesting. So a lot of times patients ask me when they have a root canal, they assume the root of the tooth is no longer there. So that's a pretty common misconception. The root of the tooth is staying. It's the channel inside, and that's the root canal.
Exactly.
So the root canal treatment is treating the canal, essentially.
Exactly. We're just helping the tooth out. We're not going to take part of the tooth away. When I show my patients the final X-ray, usually, and they ask me, "Oh, the roots are still there. You didn't do the root canal." I'm like, "No, no, no. The inside of the tooth is treated. The tooth is going to stay. The roots are going to stay in the tooth. That's what keeps the tooth there, essentially."
You know what? I might want to have you send over some X-rays so we can sort of add them onto the screen so people can see what that looks like.
Of course.
So everyone kind of assumes root canals are this super painful procedure, and there's a lot of fear around it. Why do root canals hurt? Let me just start with that. Do root canals hurt?
Oh, that's a great question, because that's always a myth that is associated with root canals. My patients come in, they're like, "Oh, this is my first root canal. I've heard all these horror stories about root
Right.
canals." And my answer is always, this could have been maybe 100 years ago, before all the technology and the equipment that we have now. What I do for all my patients is just to make sure this is an easy procedure,
Right.
painless, completely painless. I always tell my patients, I can't numb you too much. I will get you numb. I will make you comfortable before I do anything. We deal with a lot of patients in pain when they come in our chair. So we understand these patients are going through something they've probably never been through before.
Right.
They're scared, they're anxious. So the first thing to do is to get them numb, make sure this is a very painless procedure. And I often
They
get
don't feel
after the,
anything.
they don't feel anything at all.
Right.
Even sometimes my patients, when I'm done, they're like, "Oh, is it done?
Right.
Is it over?" And I'm like,
Right.
"Yes, we're done. We're completed." And it's just a misconception of root canals. The word itself sounds a little
Right.
extreme. Yeah,
Whenever I tell patients that that's what they're going to need, I always am very careful to say it because there's so much of it. There's so much baggage surrounding the term root canal. And
true.
I still do. I do many root canals in my practice, and I send some of the even more challenging cases to Dr. Elsabee because that's what his specialty is. And so, in scenarios where I know that I really could use his expertise, I send him over. But I always find that the procedures that they fall asleep during the most are root canals. People are
True.
passed out during root canals. And I think that part of the reason is because for so many people, they come in with pain. So they associate pain of a root canal with the pain that they already are experiencing when they need it. So it's hard to
True.
dissociate the two. And
True.
then when they see you guys, you get them so numb, or we get them so numb that finally they're experiencing comfort for the first time in maybe weeks, maybe even
True.
longer than that. And so instantaneously, if they feel trusting, they're falling asleep and they're kind of relaxing through the whole procedure.
Absolutely. Absolutely.
You find that kind of be the same, like a lot of people sleeping in the chair?
Yeah. Yeah. We get that all the time.
It's
It's the
amazing.
best compliment an endodontist can get.
Exactly, to fall asleep.
Yeah. Yes.
So
Yes.
tell me how root canal procedures have changed over the years. I mean, technology, how has the thought process changed over the years? You don't
Well,
have to get too
modern and
technical.
yes, yes, just general headlines. Modern endodontics has completely improved with the training. First of all, we are highly trained now, and we do have a lot of equipment that help us navigate better through the procedure. For example, the dental microscope.
Right.
It allows us to see very well inside the tooth. Without it, we can see well, but not as in detail. The other thing that has changed a lot in how we practice dentistry is the CBCT machine, which is a 3D X-ray that allows us to diagnose all the infections that could be happening, or also identify the anatomy inside teeth. Sometimes diagnose what we call fractures or cracks in teeth, help us make a better judgment on how these teeth are better treated. I think throughout the last 20, 30 years, the endodontic treatment has changed completely than before.
Right.
And I think most of the bad association with pain and bad experiences were associated with older endodontics that are no more practiced, especially at least in my office. Yeah.
Right. And some of the technology we have now, it's just allows us to see things that we were never able to see before. And what I find interesting, it's, when we were in school, Pluto was a planet, and now they're saying it's not a planet. It's like, it's similar with root canals at times. We expected a first molar, for example, to have 3 canals and then outliers 4 canals. But now we find the exception is to not have more canals. And it's like, okay, well,
True.
now we expect, even since you and I graduated, because of the advancement of technology, we expect to have more canals in a tooth. So
Yes.
actually, let me take a second to explain that. Do all teeth have the same root canal procedure, or is there something that varies between teeth?
Essentially, the procedure is very similar to all teeth. The anatomy dictates what's the best way to treat them. Some variations that we face are what we call calcifications or severe curvatures in canals. That has to be treated in a different sequence almost than the regular, straightforward tooth. And that, as long as we know what we're facing, I think we're better equipped to kind of handle it. Some teeth have infections that require different kind of medication to be used. Sometimes they need medication to be left inside the tooth for a period of time to allow the tooth to be disinfected, the inflammation to be brought down to a level that the patient's comfort while finishing the root canal, and better prognosis essentially in the future.
So root canals
But
can
the
take
procedures,
one or more visits?
usually 1 or 2 visits.
Right. Okay.
Yes.
Now,
Yes.
what's the difference between doing a root canal on a front tooth versus a molar?
Well, the first thing is the comfort of the patient. If the front tooth is very easy for us to reach, patient doesn't have to be open as much. And the back ones are a little bit harder for us to reach, to see. Patient has to be open for a little bit longer. The anatomy inside the teeth, comparing front to back teeth, the more further we go back, the more complicated the anatomy is with extra canals.
Right.
So, for example, the front tooth only have one canal, which could be very straightforward cleaning, short period of time. But if we go further back to maybe one of the molars where they have 4 canals, as you said, that's just 4 times the time needed to clean that one front tooth.
Right. So you're doing the same procedure just multiple times because there are multiple canals.
Yes, yes, and
So
we
a
got to
front
find
tooth
them all.
typically doesn't take as long as a molar, for example.
Yes, yes, essentially, yeah.
Okay. So what would someone expect after getting a root canal? What should they expect?
Well, the first thing they should expect is the reason that brought them in is resolved, which is most of the time is pain. You should be, for example, patients come in with having a lot of cold sensitivity to drinking or eating. That should be gone right away after the anesthesia wears off after the root canal. So the main thing is resolving the reason for the visit. And then there's some post-operative sensitivity sometimes. Every time a dentist works on you, you're getting needles, we're putting instruments inside the tooth. So it'll be a little sore for a couple of days. I always tell my patients, it's going to be a little achy for a couple of days, but then it's going to get better. Usually nothing an Advil or Tylenol can't handle.
Right. I always tell my patients every tooth acts a little differently, even though we're doing the same process and it's repeatable and predictable. I might have a patient after root canal and they feel absolutely nothing and it's like beautiful, voila.
Yes.
And sometimes patients have some lingering sensitivity. It all depends on how much inflammation, how much infection there was
They presented with.
the root canal.
Agree. I always tell my patients that the post-op sensitivity, the best description for it is we're putting a new filling material inside the tooth. It's almost like a foreign body to your immunity. Your body doesn't know what's going on. So the first thing your body does is send police cars to investigate, which is our inflammation cells.
Right.
Once we know that this is a good material, nothing to worry about, that inflammation goes away. That process takes about 2 to 3 days for it to resolve. And after that, you're back to normal.
That's a really good. I like that analogy. The police car. So here's an interesting question. Antibiotics and root canals. Do you always need to be on an antibiotic for a root canal?
Well, the short answer to that is no. You don't always have to be on antibiotics, but certain cases could require antibiotics, especially with swellings. People are feverish. The other question I get is always like, can an antibiotic treat the root canal?
Right.
When I tell my patient there's an infection there, yes, they say, oh, can I just take an antibiotic before it goes away? What antibiotics essentially do is to pretty much just boost your immunity a little bit to get in control of these little infections around your teeth. They could mask the problem a little bit, but it's not the cure. It's not the final resolution of the problem. What needs to be done usually is to clear the source of the infection, which is inside the tooth. the antibiotic run around the tooth in your blood vessels, but they don't get into the canals of the tooth.
Right.
The only way to clean that is through a root canal treatment done by a dentist or an endodontist to clean the microbes from inside the root canal, which allows your body to heal once the source of the infection is gone.
What would be the long-term prognosis on it? I mean, there's so much variety, but for a relatively healthy tooth prior to the root canal, what's the 10-year prognosis on a root canal? Like, how long should patients expect that to last?
Well, that depends on a lot of factors.
Yeah.
If we're just talking, yeah, exactly. Yeah. It depends on, there's endodontic factor, which what they present it with, like you said, the status of the tooth, if it's infected or just inflamed, meaning there are bacteria or not. If there are bacteria, they try to resist removing them by causing further infection. If there is microbes, I think the success through the signs is about 85% or so. If there are no microbes, it's in the high 90s. It's not a problem. We're just eliminating the source of inflammation. But that's from just the root canal standpoint. But the other factor is
the dental
what the patient eats. Yes, where is the tooth in the mouth? Is it a back tooth? Are we eating a lot of hard food on it? Eventually, all these exactly if you're going to get a crown or not, which we usually recommend a crown after a root canal treatment to further, strengthen the tooth after the treatment. So all these factors kind of play into it, but I would say taking care of your teeth generally, getting the crown after the root canal, coming in for your 6-month checkups and whatnot, that also enhances the long prognosis of the tooth to live. Yeah.
Right. It's not set it and forget it. You still need to, maintain the tooth. You still need a whole bunch of factors to make sure that it lasts long term.
Absolutely.
So what's something interesting about endodontics that you would want patients to know? Just something interesting that you've learned? And I know endodontics has come so far, but what's something interesting that you would want to share with people?
From my experience, I'll give examples from a couple of different procedures that endodontists get to do other than root canal therapy. One of them is what we call replantation.
Yes. Talk about that, actually.
It's a procedure. Every time I explain to my patients, they think I'm crazy. And the reason for it is, I'm going to give you an example. A tooth that has infection, for example, and the only way to treat the infection is through a surgery, but for anatomical reasons, there's some nerves that run close to the tooth or an artery or whatever reason, we can't do that surgery. So the only option that the patient is left with usually is extraction. So I come in this picture and I say, let's extract the tooth, but instead of throwing it away, let me treat the tooth and put it back in the mouth again. And we do that very safely, and most of the time it works. So, and patients, every time I tell them that, do you think I'm crazy? Do you think I'm like, what do you mean by extracting the tooth and not throwing it away? You're gonna put it back in my mouth? And I think we've had cases together we've done that, and it just works just fine. And it's amazing what we can do.
Yeah, that's cool. And it's not all that different from it's really snowing outside now.
Yeah, I can see
we're on
it
the East Coast here. So sometimes a baby, or not a baby tooth, a new adult tooth, kids are always falling and all that stuff. You'll see like, oh, maybe get in a sports accident or they trip and fall, tooth comes out. The tooth can actually be root canal treated and reimplanted. So even with adult teeth later on in life, it can still happen, right?
Yes. The body has an amazing ability to heal once the source of the problem is gone. Once we clean the source of the problem, your body's going to heal no problem. So that is one of the craziest things that I get when I tell my patients about treatment. The other interesting fact about endodontics that we can grow teeth back to life again with a new procedure called revascularization. Mostly in younger individuals. Sometimes, as you said, in sports accidents, teeth can go non-vital, which means the nerve is dead. That is usually associated with infections. And before this procedure, the treatment is usually either a root canal of some sort or extraction of the tooth.
Right.
But now with this revascularization procedure, we're actually allowed to treat the tooth, keep the tooth in place, treat the infection, and allow the roots of the tooth to grow, which strengthens the tooth down the road. And sometimes teeth can get vital again, meaning you can feel hot, cold, and it's going to be a normal tooth.
Oh, wow. Is this like epexogenesis? Is that what you're sort of referring to, or is that a little different?
So epixigenesis and epixifications used to be the procedure we would do before revascularization. Revascularization is the new modern procedure which allows the tooth to actually grow rather than stopping the growth at whatever level the tooth got, traumatized at.
Oh, I think we'll need a part 2 to this interview. So I can learn a little bit about that. That's actually not something I'm familiar with.
I have some beautiful cases that I can show you. I think we did one with you and Dr. Tai for that dens invaginatus. That was the
Oh,
treatment
yeah,
of
that was an
choice.
interesting one. Right.
Yes, yes, yes. That was the treatment of choice for that procedure.
Right. Well, I'm so glad I had you on my side for that one. That was a really
Oh,
interesting case.
yeah.
Okay, so we're gonna do a couple more questions here.
All right.
This is just a kind of a funny one.
All
What's
right.
your favorite tooth and why?
What's my favorite tooth or why? Oh, I think if I have to, they're all my children, right? I love them all equally. But if I have to single out a tooth, it might be first molars, upper first molars. I like the challenge of finding hidden anatomy. For example, that fourth canal, for example, that you mentioned,
Sure.
very small, very hard to see without a microscope, and it changes its position from one tooth to another. So we carefully look for it, and I do. That's my. A lot of people don't like that because it's
Yeah.
annoying, but I'm a nerd. I love looking for it. I'm finding it. Sometimes I don't give up, and I just enjoy being that much of a nerd to
It's
find
very
it, and it's
gratifying.
satisfying. Absolutely,
Oh, yeah.
absolutely, absolutely. I just know that I'm giving the best care I can to my patients by just not giving up on these things.
Right.
They make my day.
That's a really good answer.
Yeah.
Okay, so what are your final thoughts on how patients can feel less anxious or have less anxiety about having a root canal, or when they hear the word root canal? What would you tell them to make them feel better about it?
I think the first thing that we should not do is ask Dr. Google what to expect after a root canal, because everyone has a very different experience, and most people who go to get a root canal are already in pain or having a problem. So, and pain perception differs between one patient to another. I would say 99% of my patients have very easy procedure. There are no issues with it. I would say don't listen to Dr. Google about what to expect. Just come in, talk to a professional, whether a dentist or an endodontist, and they will explain everything to you. And if there's something to expect, some sort of pain or a pinch here or there, I like to let my patient know before it happens so that, fear of the unknown or what's going to happen all the time is eliminated. If I tell my patient there's a little pinch here and it happens and it will go away, and that exactly what happens, my patient's comfortable throughout the whole time.
That's really
So
great advice.
yeah, it's just don't listen to
Yeah.
the fake
Yes.
media.
You search WebMD for anything, and all of a sudden you're dying. So
You're in the ER at 3 a.m. because you have
yeah.
a headache.
Okay, so where can we find you online? How can we follow you? And then just let us know where you're practicing again one more time.
Well, I do have an Instagram that I should be more active on. It's called Elsabee Endodontics,
I'll put a
elsabee.endodontics.
link in there too for you.
All right. And I do practice in Stratford, New Jersey at an office called Endodontic Specialist. And I do practice in Exton, PA at Exton Endodontics.
Beautiful. Well, thank you, Dr. Elsabee, for joining us on our very first Doctor to Doctor.
This was fun. I loved it.
This
It was
is
really great.
great. Yeah, thank
This
you.
was really great. Yeah, and I love that it's oriented to like the general public. This is not for specialists trying to do like high tech procedures, but we're just giving an explanation to what we do, and so people can know better what we do and expect better procedures, better appointments.
Exactly. Perfect.
Yeah,
Well,
that's
thank you again,
awesome.
and I look forward to
Yeah,
doing this again with you again.
of course, of
All
course.
right. Thanks,
All
Rami.
right.